In Chapter 14, we're going to talk about the drugs that affect the autonomic nervous system. What makes this chapter somewhat challenging is the nomenclature of the drugs that are being used. If you can keep in mind that what we're really talking about here is either blocking a receptor or enhancing a receptor. And we're really talking about either the parasympathetic nervous system, where the neurotransmitter is acetylcholine, or the sympathetic nervous system, where the neurotransmitters are either epinephrine, norepinephrine, or dopamine. I think it'll be a little bit easier as we go through this if you just try to simplify some of what's in the textbook in terms of the terminology. Some of the drugs that affect in the autonomic nervous system, we have either cholinergic or adrenergic responses. The cholinergic responses include constricted pupils, increased saliva, bronchoconstriction, increased gastrointestinal mucus, bladder fundus contraction, and then in our adrenergic side, we have dry mouth, dilated pupils, increased contractility, increased heart rate, bronchodilation, bladder fundus, and the can be relaxed, and the sphincter can contract. So going back to what I said in one of the first slides, we have to look at the classification of autonomic nervous system drugs, really looking at it's either parasympathetic or sympathetic effects. Cholinergic drugs are essentially almost entirely parasympathetic because the parasympathetic nervous system uses acetylcholine almost exclusively to send its messages. So again, those are going to be parasympathetic, whereas our cholinergic blocking drugs might be parasympathetic. They can also be anticholinergic or anti-muscarinic. And again, that's a receptor that I can never pronounce properly. Adrenergic drugs would be again, your drugs that mimic the action of the chemical messengers of either epi, norepi, or dopamine. So these are drugs that are used in shock, allergic reaction, asthma, cardiac arrest. And conversely, the adrenergic blocking drugs are more sympathetic as well, but they're going to block stimulation of the CNS alpha adrenergic receptors, and they decrease sympathetic stimulation to the blood vessels in the heart. So again, they're just working in a different way. We further simplify or further break down adrenergic responses and activities by looking at whether it's alpha or beta. An alpha adrenergic physiologic activity includes vasoconstriction of the arterioles, which is going to result in higher blood pressure. We see pupil dilation and relaxation of the gut. Beta adrenergic physiologic activities include cardiac acceleration and increased contractility, vasodilatation of the arterioles that supply the skeletal muscles. We see uterine and bronchial relaxation as well. The primary use of the adrenergic or sympathetic nervous system drugs really depend on the receptors that are being activated. If it's an alpha-1 receptor, we see these drugs being utilized with nasal congestion, hypotension, dilation of the pupils for eye examination, alpha-2 receptors being utilized with hypertension, beta-1 receptors in conditions like cardiac arrest, heart failure, shock. Beta-2 receptors more of the asthma and premature labor contraction uses. And I'm going to stop right here and make the beginning of this slide set from slide 7 through 18 as part of a second set of slides, so that way this lecture isn't quite so big. So please know that I will start with slide 7.